And this is very similar to a project that we did in Nepal. So I was in Nepal last November, and we launched a computer lab there as well. And so we went in this room, and it was the official grand opening, so I was there to cut a ribbon and open this thing, and government officials were there. Well, what had happened was this lab, computer lab, had gotten set up about 3 days before the official opening. So the kids had been in there for 3 days, getting on the internet and using the computers and so forth. And these were kids who hadn't had access to the internet before. And when I got there 3 days later, they were already on Skype with their friends, they were on Google, they were on, I mean, anything you can imagine. We conducted a little kind of a treasure hunt on the internet for them. These kids found pictures of this and quotes about that and facts about other things. It was really phenomenal to see the way that the kids adopted it. So we're doing the same thing here. And you just imagine you give a child who hasn't had access to the world access through 3G connectivity in a place where they never had it. And all of a sudden you're literally changing these children's lives for the better. Another area that we've done in education is, so we've done a project in the United States. And now when you think about cell phones in education, most teachers say, well, I don't want a cell phone in my classroom. That's going to distract my kids. They're not going to be able to focus on what they're supposed to focus on because they're going to be texting, or maybe they'll cheat on their test by telling each other the answers. Also, you hear all sorts of stories. Well, we wanted to disprove this because we believe very strongly that wireless could have a really big impact on education. And so we then went and did a project called Project Connect in North Carolina. And we started in 2007-2008 school year. And essentially what we did was there would be an algebra class, so a math class. And one teacher had two different classes. One class we gave the smartphones to, the other class didn't have the smartphones. And on the smartphones was math curriculum, so they could learn about various math problems, but they could also network socially among each other. So the smart kid in the class could help out some of the other kids, and they could get in touch with their teacher, and they would actually have access to the curriculum and to the internet on times when they were out of school, and many of these children didn't have access to that kind of capability themselves. And so what's very interesting is that if you look, now this has happened a few years now, and this class that had access to this technology, the kids scored 30% better on standardized tests than the kids who didn't have access to the technology. So that's just, that's astounding. I mean, the kids, essentially the kids in the class with the smartphones basically aced the test. And so that really proves the kind of capabilities that we can have with wireless, giving added connectivity, giving full-time access to educational materials, to their teachers, and to their students. And so what's happened now is this program is going to be expanding. So the U.S. Department of Defense education activity granted a school that's going to run this program a $2.5 million grant. So it's sustaining itself as well. Other groups are coming in and helping to make sure that this capability continues and that the kids have access to this. And we're looking forward to being able to spread this kind of capability around the world. So in addition to education, we're also doing healthcare. And so this project in Peru is a fairly early project that we did. And what we did was there's a clinic that was it was a very remote clinic up in the mountains. And every so often, doctors would come from Lima or from the United States in some cases and go up to this clinic. But then they would only stay there for a certain period of time and treat people, and then they would leave. So the people didn't have the best follow-up care. So what we did was we used a 3G connection and a webcam and put it into this clinic, and then the doctors were able to sit in Lima or in the United States and do follow-up care for the children. And in fact, in many cases, this was associated with cleft palates. And so what's really important in that case is that there is a speech therapist that can teach the child how to talk well once the operation is done. Prior to this kind of connectivity, didn't have that ability. It was done by somebody locally who did a fine job, but clearly not the same job that a highly trained expert would do. And so that literally changed people's lives, and that project's been going on for quite a number of years now, and a really exciting sort of application of what you can do to improve healthcare through just the ability to connect the doctor to the patients. And so this is an area that we think is really important, because healthcare, as we all know, is a critical problem around the world. One of the key issues in many countries is that the populations are aging, and the doctors are aging at the same rate. And so doctors will be retiring at the time when their services are most needed to support that aging population. So what do we have to do? We have to improve the productivity of the doctors, and we have to improve people's wellness, their health over the long term, prevent them from getting diseases. And what does that have to do with the cell phone? Well, the cell phone will give you full-time connectivity to a healthcare professional. Not to say that you're talking to that healthcare professional, or not to say that they're monitoring you 100% of the time. It's sort of like today, when you have your cell phone, you feel like you're in contact with your friends and family and your work colleagues, not because you're talking to them, but because you could. Same thing will happen with healthcare. You will feel like you're being taken care of, even though you're not talking to your doctor right at that time. Now, one huge opportunity for mobile health is chronic disease. About 75% of the healthcare costs are used for treatment of chronic diseases. And what are they used for? They're used because people are not complying with their treatment regimen. So in the case of diabetes, for example, people may allow their blood glucose levels to go out of the range that you want it in. We talked to an insurance company in the United States. They told us that if you have a diabetic who's taking care of their health versus a diabetic who now has complications because they've allowed their blood glucose levels to go up and down dramatically, it's about 15 times more expensive to take care of the person who has not controlled their diabetes. That's just a huge, huge cost. Not to mention the fact that the quality of life for that person is degraded tremendously by having these complications. So we can improve people's lives this way. We can have sensors that they wear on their body. That's what's going to happen in the future. Today we can do all sorts of monitoring, and it's not just for diabetes. It's other kinds of chronic diseases. Hypertension is a really good example of something where you can monitor fluid levels in the body. You can monitor heart rate and heart symptoms. And what's interesting is in the emerging markets, we're seeing that it's not necessarily the case that you have the trained professionals that are going to be able to go out, because many of these regions, there's a big rural population. So what you need to do is you have a semi-skilled person who goes out with the mobile device, collects information, and then brings that back, like I said we did in Peru, brings that back to a central location where skilled professionals can then look at it, evaluate the issues, and help in the treatment. And so, so diabetes is really a critical issue, but there are many others. So let me just focus on diabetes again for a second. So around the border region, there's 7.5 million people who are 18 years old or older. Of that 7.5 million people, 1.2 million have diabetes. It is an unbelievable health problem in the border. About 500,000 of those people live on the Mexico side of the border, and about 700,000 live on the U.S. side of the border. And so we're actually working on a project called Project Dulce. And the idea here is that we're working with a clinic here in Tijuana. That clinic in Tijuana has 26,000 people that they're treating that have diabetes. And they don't really have very good tools to communicate with their patients. And so what we're doing is we're using the phone to actually make that happen. And so we have this project, Project Dulce. It's one of our wireless reach projects. And basically it's mobile applications, web applications, mobile phones, netbooks, all sorts of capabilities to give the healthcare worker and the patient access to information about their healthcare and how to manage their diabetes very well. And it's also a really interesting example of partnership, because, if I can change the slide, because it's a broad range of partners that are working on this project. It's a binational group. It's a public, private, and nonprofit group of organizations. So we're working with the Social Security Institute of Mexico, the International Community Foundation, and their sister organization, the Scripps Whittier Diabetes Institute, Pro Salud, IUSACEL, and the Autonomous University of Baja California. And what's really interesting is that each one of these partners comes together and brings their own piece of the puzzle. And so what I'd like to do now is invite one of our partners up to the stage, Adrian Steckel from IUSACEL. He's the CEO of IUSACEL. So Adrian, can you come out and tell us a little bit more about this project?
Good afternoon. Paul, thank you so much. Muchas gracias. Voy a hacer eso en inglés para que Paul me pueda entender. I think some of the things that Paul has touched on, there are three things that I want to, first of all, cover basically, which is one, we're very proud to work with Qualcomm. As you can see, Qualcomm is trying to figure out how do you take technology, wireless technology that's evolved, and make it useful in everybody's lives. I mean, I think everybody knows what a BlackBerry is, what an iPhone is, and that's all very good for a certain class of work that people are doing, but it's not something, it's something that helps you be productive in your workplace, but it's not something that really truly changes the way people live, it changes their lifespan, and changes their ability to make money. What's very interesting about the experiment and the project that we're involved with in Dulce Wireless with Qualcomm and with ILIMS is that it's an application that's, one, is cutting edge. This is the sort of thing that is on the cutting edge of whatever anybody's doing in the world. And what you're trying to do is make it easier and better for patients to take care of themselves and for doctors to organize that care.